Signs of a stroke include paralysis, weakness, tingling, burning pains, numbness, confusion, and slurred speech. You should get to an appropriate emergency center immediately. Early treatment may prevent permanent damage to the brain or even save your life. A stroke may be caused by a blood clot that has formed in one of the arteries that supplies the brain with oxygen. A stroke can also be caused by a blood clot that is formed in a vessel somewhere else in the body, including the heart, and has traveled through the blood to a vessel in the brain. The area supplied by the blocked blood vessel is rapidly damaged. The loss of oxygen affects the brain first before any other body organ. A few minutes of oxygen deprivation can result in permanent loss of function. Symptoms of a stroke are related to the particular area of the brain that is involved. If a large vessel is blocked, such as the middle cerebral artery, a large area of the brain will be affected, causing paralysis of one side of the body. If a smaller blood vessel is blocked, then paralysis may be limited to an arm or leg. The right side of the body is controlled by the left side of the brain, and vice versa. Also, one side of your brain is dominant for comprehension and verbalization. For example, if you are right-handed, the left side of your brain is dominant. If you have a large stroke on the left side of your brain, you might be unable to speak or comprehend and will be paralyzed on the right side of your body. If the stroke is on the other side, it will not affect your ability to speak, but you will be paralyzed on the left side of the body. A stroke can also result from rupture of a blood vessel in the brain and hemorrhage. Cigarette smoking, uncontrolled high blood pressure, and uncontrolled diabetes increase your risk of having a stroke. A new treatment for immediately dissolving blood clots in the brain is available at most emergency centers. If instituted soon enough, the treatment can stop a stroke before permanent brain injury has occurred. At the time of production of this video, there is a clotbuster therapy available which must be given within 3 hours of the onset of symptoms in order to work. The sooner, the better. Newer medications being developed may work for a longer period of time after symptoms first appear. However, this therapy is not appropriate for all stroke victims. For example, if the stroke is the result of a hemorrhage in the brain, you definitely do not want to get clotbuster therapy or a blood thinner. You need to be aware of stroke symptoms, call for an ambulance, and get immediate transportation to an appropriate emergency room. All stroke victims need urgent evaluation, even if you are not able to get to medical care in the first 3 hours. Do not wait.